My pain level was pretty high. It was debilitating. I lived in a two-story home. It made us want to move because our bedroom was upstairs. It was very hard to get up and down. I work a job where I had to sit for extended periods of time, and it made it hard for me to kind of get through the day. I'd have to get up about every 45 minutes. And then by the time I got home, I was wiped. I couldn't really just deal with much more, so I'd just go home and lay down. So I had very little after business hours interaction with anyone, because really all I wanted to do was just kind of lay down and try and ease the pain a little bit. I came into the doctor, and the first thing they did was sent me for an MRI. It showed some abnormalities, but nothing that was kind of real obvious. So we started with the steroid injections. We went through 4 rounds of steroid injections, nothing really changing, doing the pain meds thing, and then we decided to do a discogram. They did a discogram, and it showed that the L5-S1 disc was causing the pain. It was in bad shape, so the 2 options were to continue pain meds or to have the surgery. I'd done, even before that, physical therapy and that sort of thing. So I chose to have surgery because I didn't want to be on pain meds the rest of my life. I had surgery on a Thursday morning. I woke up, it was like maybe 2 hours that I was completely out. I felt a big difference in pressure and just what my back felt like immediately as soon as I woke up. There was some incision pain, but that pain versus what I was feeling before in my back was nothing. I went home Friday morning, and I stayed home Saturday and Sunday. I went back to work on Monday. So I was very, that much relief in pain that the incision pain was nothing in comparison. So I was able to start working, and then within 2 weeks I got to the point where I could begin to start carrying things. I didn't have to have someone pull my laptop bag out of my truck or something like that for me. I don't have any restrictions, on what physically I'm able to do. I'm actually in the Marine Corps Reserve, so I have high physical demands on me. For our fitness tests that we perform on a biannual basis. Work-wise, I'm able to sit long periods. I still do get up and stretch because it just feels better. But it doesn't have to be every 45 minutes. And then, when I get home at the end of the day, I still have energy and the willpower to continue to do other things. The incision pain from going in through the abdomen was not as bad as I thought it would be. It really felt like you had overdone it with an ab workout a few days in a row. So anyone who's been in the gym and done it just a little bit too much, they probably already know what it feels like. You feel some restriction, some tightness, but it's not something that you can't deal with just being cautious about your motions. The first few days were obviously the worst, but still very manageable. And then within a week, I had all the dressings and that sort of thing off, and as soon as you get open air on it, it really starts to heal pretty quickly. The only thing I would probably do differently is had gotten to that decision quicker. I put it off and thought surgery was the absolute last resort, which I don't think it should be the first option, but 4 rounds of steroid injections was probably enough to, 2 was probably enough to tell me that it wasn't going to work. So that was a few months of pain that I incurred that I could have been that much further along post-op.
How are you doing today?
Good. How are you?
Tell me a little bit about how you're feeling.
Much better. Much better.
So, if I got it right, you're about 6 months.
Mm-hmm.
And remind me, just tell me again how you felt before your surgery.
I had a hard time walking up and down stairs or just really walking around much at all. Was not really sure of my steps. And then afterwards, it was, after 2 weeks, complete difference. The moment I woke up, I felt better, a relief in there. So. But
in terms of your pre-op stuff, in terms of your symptoms, your pain was primarily in your back.
Yes, and with shooters down the leg occasionally.
And would you say it was a disabling pain?
Yes.
Okay.
Yeah.
And you'd had it for a long time. You were in the military, right?
Yes.
And you actually had to stop being able to be deployed. You were supposed to be deployed and you weren't able to be because you're in the reserve and your pain was so much that they were ready to kick you out of the military.
Yes.
You couldn't do your job.
Yes.
And if I'm not mistaken, you're in an IT or high-tech position now. And wasn't it also hard for you to even do that?
Yeah, I mean, it requires a lot of sitting and typing, and, being at the computer all day. So it was hard for me because I had to break every 45 minutes, kind of get up, walk around.
And you went through medications and all that sort of stuff and therapy. And then, if I'm not mistaken, you had an MRI scan. It was a little abnormal, but we went ahead and got the discogram and CT scan, and that really showed us that that lowest disc was the bad disc.
Yes.
Okay. And the surgery took us about an hour, and then you went home the next day, right?
Yes.
Or was it the same day?
No, I stayed that night.
Yeah.
And then that was Thursday was the surgery. Friday morning I went home.
And when did you go back to work?
Monday.
Okay. And so basically 2 business days.
Yeah.
And would you mind just kind of lifting up your shirt and showing us your incision?
Sure. They're right there.
So it's a little incision right here, and I call this the hook 'em horns incision. We're here in Austin, Texas, and we have a hook 'em horn sign that's about the size of the incision on the lower abdominal wall. If your pain before the surgery, if you describe that as disabling, how long did it take you before you felt good?
2 to 3 weeks.
That's all?
Major difference. So.
And what about now, 6 months out?
There's not much that I would be hesitant to do other than something that would be heavy vertical load, like a squat or something like that.
Okay. And you're in the Army Reserve?
Marine Corps.
Marine Corps. And are you back on active duty reserve?
Yes.
So you could be deployed anytime?
Yes.
And you'd be carrying an 80-pound minimum sack?
Yeah.
All your equipment, your rifle, and you'd be able to do it?
Yes.
At 6 months?
Yes.
So would you say you're pretty satisfied with the surgery?
Very satisfied.
All right. As you know, this is the cage that we placed into the center of the disc, and it's an intervertebral cage. And in your case, I used 1 screw up and 1 screw down. And I used material that stimulates bone growth, and I put some in the center of the disc space and then a little bit out here in the front. And you can see that you've got new bone formation all the way around in front of this disc and through this disc space through the implant. And then this is looking at you from the front, and it shows the screw going up into one vertebra and down into the other vertebra, consistent with this and this. So this is 6 months, and you're solidly fused. And I guess from my point of view, it's a wonderful thing to have a young, healthy, motivated patient who's in good condition. And would you mind bending over to touch your toes for me?
Sure.
And come on back up, and let's just have you lean to your right, lean to your left, lean back against my hand. Good. Now, do you feel like your range of motion is markedly worse or better?
I don't, well, I mean, I can move more now than I could before the surgery, but I don't feel like I really lost any range of motion from prior to that. The only time I really noticed it is like stretching.
So you were pretty limited in your motion before the surgery because it hurt. Well, this is an interesting point because a lot of patients feel that, well, if I have a fusion, I'm going to lose a lot of motion. And I've come to learn from my patients that most of the motion when we're bending, particularly forward or backwards, is occurring around the ball joint of the hip. So if you do a 1-level fusion or a 2-level fusion and the patients are naturally limber and flexible, you can still have very reasonable motion. And it's actually perhaps a larger range of motion because it's not painful. Pain limits us in our movements. Do you have any questions you want to ask me?
No, I'm pretty good.
All right. Well, I really appreciate your taking the time to come in here for your 6-month follow-up, and your x-rays look great. I agree fully that you could go out and be on active duty in the Marine Corps. If you get deployed, I don't want you to go because I want you to stay here and be safe. But I understand that that's your duty to the United States.
Thank you.
Thanks.